Hello, my name is Montserrat Wilkinson, and today we are going to talk about surgical technology, the demand for it, why now is a good time to become one, how to become one, and what surgical technologists do. So the demand for surgical technologists is rising. According to BLS.gov, it's going to increase by 6% in 2033. And that is an increase of 6,500 jobs. And I also want to reiterate that about 8,700 openings for surgical technologists and assistants are projected each year on average over the decade. That also has to do with the contribution of people leaving the workforce, retiring, or switching jobs. So due to technological advances and medicine advancing, the increasing age of the baby boomer generation is making it so that there's higher demand for surgical procedures. So employment's going to go up because there's a higher demand for it. Also, people are retiring, like I had stated before. Surgical technologists can work in an ambulatory setting, outpatient settings, dental offices, hospitals, and so you're not stuck just working at a hospital. You have options. Also, along with increasing technology and advancements in medicine, like I have stated before, there's minimally invasive and robotic surgeries that are becoming increasingly common. And along with that, people need to be educated in how to work them. And the people that drape them, set them up and everything are surgical technologists. So the demand for locations that have minimally invasive procedures contribute to the demand for CSTs. Also, how to become a surgical technologist. So you would have to find an accredited program, and you can do that by looking it up on www.caahep.org, and you can complete the prerequisites and then apply, and then you have to pass the program. In the program, you have to have a certain amount of clinical dates and cases in order to take the certification exam. The certification exam is administered by the National Board of Surgical Technology and Surgical Assisting, which is long for NBSTSA. And in order to maintain certification, you have to submit continuing education credits every 2 years. Or if that lapses, then you have to retake the CST exam. Also, what do surgical techs do? Surgical techs facilitate safe and effective sterile technique in the OR. They help make sure that the instruments are not contaminated, that the people around us, who work with surgical techs, don't break technique either. And they have roles in pre-op, peri-op, and post-op case management. So it's not just being in surgery. Also, there's first scrub role, second scrub role, and the second scrub role carries out the tasks that are not performed by the CST in the first scrub role. There's also, we sponge surgical wounds, we apply electrocautery and clamps on bleeders, we maneuver endoscopic cameras for the surgeons, and we also suction blood and body fluids. CSTs are important because they play a huge role in infection control in the operating room. So surgical technologists, they uphold standards for not just themselves, but everyone in the OR. And a vigilant surgical technologist will ensure that every step of the surgical process prioritizes sterility and patient safety. So it's up to us to say, hey, You can't be touching your mask with your sterile gloves. Now you're unsterile, and we've compromised the patient because we don't want to give them infections post-op. Also, we need to maintain sterility when we're preparing for a case, and then during the case, and then if there's a team member who has had a slip up, we try to communicate with them and educate them so that that mistake does not happen again. Thank you.